Physio and Massage can't help me because I've got an arthritic hip. So is this true? Or can physio or massage therapy actually help you if you've got arthritis of your hip joints? So today we're going to look at a revised clinical practice guideline, which is based on all the evidence that's out there and makes recommendations towards what can help arthritis, osteoarthritis of your hip. And they're making these recommendations, they're peer reviewed, they're based on pain, and they're based on mobility and function. So what did they say about manual therapy itself? Firstly, what is manual therapy? So manual therapy is anything which basically moves joints, soft tissues, mobilizes, manipulates the joints, hands-on type sort of things. So sports massage would be in there, lots of physio techniques in there, even chiropractic and osteopathy techniques are in there as well. But it's basically moving things around, stretching things, pressing into things, trigger point releasing, myofascial release, you name it. They're all manual therapies. And there's plenty of them. It's not just one little thing. It's a massive, massive entity in itself. So what did the guideline actually recommend in line with osteoarthritis of the hip with manual therapies to improve the outcomes in pain, function, mobility? So for mild to moderate hip arthritis is where they found the benefits lay. They found that thrust and non-thrust mobilization and manipulation type techniques, which are when you're oscillating the joint, distracting the joint, gliding the joint, or actually really forcing the joint beyond its natural range, are actually very viable treatment modalities for mild and moderate hip arthritis. They also found soft tissue mobilization, so massage therapy, myofascial release sort of things of that nature, because again, you're going to have a lot of tightness in the tissues, you're going to have a lot of spasm in the muscles. So this sort of type of technique is definitely also viable for pain, mobility and function of mild to moderate arthritis and is recommended therefore in the guideline. Now they recommend the manual therapy to be done 1 to 3 times per week over a 6 to 12 week period. Now I know this is quite a lot and certainly 3 times a week would be, but again it's not for the long term this. They said that after a certain point in time when pain is getting under control, function starting to build up, you need to compound this with obviously building up all their strengthening and stretch based exercises, mobility exercises to assist that long-term outcome. So it shows you that maybe this manual therapy approach isn't necessarily going to be a long-standing thing, but it's certainly a thing to enable the exercises to then sustain the progress made from that initiation of pain dropping, function improving, mobility improving. So yeah, overall, if you've got an arthritic hip, manual therapy, massage therapy, mobilizations, manipulations, they're all viable according to this clinical guideline, and it's based on the evidence, it's peer-reviewed, and it's up to date. So anyway, that's it for this video, and I'll see you next time.